Hi, I'm Mike, your pharmacist, and thank you for joining me on the Daily Dose. Today we're going to be talking about a public health emergency that is caused by opiate overdose. There has been a drastic rise in overdoses, and it's caused by a potent opiate called carfentanil. Why do you keep hearing about carfentanil? Well, because it's killing a lot of people across the world. Carfentanil is an opiate that was developed in the 1970s by veterinarians. It was used to tranquilize large animals, literally bears and elephants, and now it's being injected straight into the veins of people. Since 2016, we've started to see it more and more on the streets. And wherever carfentanil goes, overdose is not far behind. To understand the potency and the strength of carfentanil, let's talk about fentanyl. It is the strongest and most potent therapeutic opiate on the market. It's used for cancer pain, palliative care, and patients who have severe tolerance. As a point of reference, here's a list of opiates in descending order of potency. The first one we have is codeine, and then morphine, oxycodone, hydromorphone, and then finally fentanyl. Morphine is considered a benchmark when comparing opiates because it's been around for so long. So fentanyl, it's approximately 100 times more potent than morphine. Now carfentanil, that's 10,000 times more toxic than morphine, meaning an amount as small as a grain of sand can kill you. It's so dangerous that the DEA is concerned it can be used as a chemical weapon. Dealers are now cutting already extremely dangerous drugs like heroin and cocaine with carfentanil. There's no way of knowing if it's contaminating your street drugs. As the provincial radio ad advertises, you can't see it, you can't smell it, you can't taste it. The opiate antidote naloxone is often ineffective against carfentanil. While it may take 1 or 2 doses to reverse a heroin overdose, it can take upwards of 10 or 12 shots to antagonize the effect of carfentanil. Here we have a graph from the NIH that depicts overdoses from all the different kinds of street drugs. In 2016, there were more than 64,000 drug overdose deaths. The sharpest increase occurred among deaths related to fentanyl and fentanyl analogs, or synthetic opiates, with over 20,000 overdose deaths. That's approximately a third of the total overdoses. Because of this extreme rise in overdose due to synthetic opiates, there is a public health emergency. Several harm reduction initiatives, such as naloxone kits and increased access to SUBOXONE and METHADONE, have been emphasized to decrease the harm caused by opiates. Now, in future videos, I will talk about what harm reduction is, methadone maintenance treatment, and naloxone. I'm Mike, your pharmacist, and thank you for joining me on the Daily Dose.